name's Jack. I'm a 30-year-old critical care trainee within the Auckland region. Originally, I started my career as a footballer before moving towards a private industry role whilst undertaking a bachelor's in sport and exercise science. And then ultimately I moved to medical school via the postgraduate route. I went to St George's, University of London, and before undertaking an academic foundation programme within North London. After this, I moved to Auckland to begin working as an intensive care medicine registrar. I've now been here for nearly 2 years. I chose to work within Auckland for several reasons. Firstly, from a personal perspective, New Zealand was a country that I really wanted to explore. It's beautiful, it's a warm climate, there's lovely people, and there's lots of things to do. And then being in a city boy, I also wanted to stay within a relatively large city, affording me the benefits of city life, whilst also being within touching distance of the beautiful nature that New Zealand has to offer. From a professional perspective, I wanted to work within intensive care in a predominantly large tertiary centre, which would allow me to continue my academic training and work after I'd settled. And after doing a little bit of research and speaking to a number of the intensivists within the area and the region, Auckland seemed like the obvious choice. I suppose my perspective is biased from my UK training, but this certainly allows a positive comparison. Firstly, I've never felt more welcomed and supported by my senior colleagues. And despite being a PGY3 when joining as an intensive care medicine registrar, and thus being the most junior of all of my colleagues, I was given the respect and the support needed to take on responsibility and to manage patients, affording me the opportunity to learn and grow. And this is a feeling that I'm certain is shared from all of my UK and IMG colleagues. From a more formal perspective, I've had all of my college exam and training fees covered and have never had an issue with annual leave, reimbursement or study leave. My meals when I'm at work are paid for. Auckland's also very lucky to have a very engaged group of critical care consultants, providing formal teaching within work, but also establishing a number of groups to support their registrars who are preparing for exams, which can be pretty tough for SICM and anaesthesia over here. There are also informal mentoring programmes and opportunities provided to support with one's personal development. I knew I wanted to work within intensive care medicine from my second year of medical school. Physiology fascinates me. I enjoy working with sick and physiologically deranged patients, and you get to make a real difference when supporting families and through the hardest times of their lives. I'm also biased, but I think that the doctors, nurses, physiotherapists, dietitians, pharmacists, psychologists, and everyone else who works within intensive care are the most impressive people within the hospital, and I knew I wanted to work with this group of people. Because of this, I undertook my elective in intensive care. I then undertook an academic foundation programme job within intensive care, and then immediately moved over here to start work as an intensive care registrar. Auckland's a really interesting place to work because despite it not being the largest city in the world, the districts are really varied in their population and the services they offer. Personally, I've only worked within Auckland City Hospital and Middlemore Hospital so far, yet despite this I've worked in 3 large intensive care units specialising in neuro-intensive care, cardiovascular intensive care, burns, trauma and spinal injury. And I've also worked within the primary ECMO centre within New Zealand and have managed patients who have received heart, lung, kidney and liver transplants. This is all only having been working here for less than 2 years. You also see a patient population with a diverse set of cultural values and experiences originating from varied backgrounds with significant variation in their socioeconomic status and health literacy. This means that you really have to think about how you can best support these people, and doing so feels like a real privilege. Working within intensive care medicine in particular can make this both challenging but also really rewarding, because I often see patients towards the end of their journey, often with preventable disease. However, I have access to the resources and support necessary to try my very best to help these people. In terms of support for doctors like me, each intensive care unit has at least one supervisor of training. They often run their own mentorship program, allocating registrars with a mentor to support their training. And there are also a number of district-wide programs to support ongoing education and professional development. There also aren't that many of us, so it's rare you go to somewhere where you don't have a couple of mates to help you and support you. do it. It's the best speciality, filled with the best people, doing the most interesting work. I think some people are hesitant to join intensive care at an early stage in their career because it feels intimidating, looking after such sick patients, often away from the intensive care unit in unfamiliar parts of the hospital, in relatively high-stakes situations. I'd reassure with those fears that there are always people around to help when needed, and you're never alone. There's also plenty you can do to prepare to make the jump. Talk to consultants, talk to registrars already doing the job, and ask for some advice. On reflection, there are a number of moments that I could list, but actually I've moved as far away from home as possible, started my intensive care training as a PGY3 in a completely new environment, and ended up as a more competent clinician, as well as a happier and hopefully more rounded human. I've a long way to go, but I think that in itself is probably something to be proud of.